have requested countries to provide as much information as possible.
How do you know when things are changing, and how do we assess when something that changes is significant or not?
How can we look at our information systems to be able to anticipate, prepare for emerging infectious diseases?
We had many major epidemics in the past, and every time we learn from those crises, we fix the mistakes, but usually fix the mistake after the crisis. So this time we would like to create order before epidemics create disorders.
I think all of you are acutely aware of the implications in terms of the destabilizing effects of these events, not just on communities and families, but on whole nations, whole regions, and one could argue globally.
We need to push the boundaries of our traditional thinking so that we can bring on board new ideas so that we can, as a global community, be better prepared for next crisis. WHO has organized this consultation on anticipating epidemics, especially for emerging pathogens, and we have brought together experts from private and public sectors, academics, NGOs, industry, and UN partners.
It's very difficult to dissociate what is happening in the animal sector and what is happening in the human health sector.
We will look at the technology, the science that is behind surveillance and infectious disease. We'll look at how we can communicate risk with communities affected by epidemics.
How do we make sure 6,000 volunteers have the right message and are interpreting that in the right way based on people's individual risk perceptions?
At the center of our communications work has to be the business of earning trust through demonstrating respect for all.
We will also look at information technology and data management.
Just in 10 years, there's been a 60% increase in human mobility through commercial air travel.
We'll look also at the health system, and finally we'll look at the globalized world and see how measures that have been implemented in past centuries are still applicable in the 21st century.
On a plus d'une centaine de personnes, d'horizons divers, de professions diverses, qui vont pouvoir échanger afin de mutualiser leur expertise et ainsi pouvoir peut-être dégager des pistes justement d'amélioration pour que nous soyons mieux préparés demain. Donc il y a bien sûr des médecins, des épidémiologistes, des scientifiques, des hommes et des femmes de laboratoire, des vétérinaires, mais aussi des spécialistes sciences humaines ou sociales ou des personnes également en charge de la partie plus économique des crises sanitaires.
The singular importance of this meeting is recognizing first off that while outbreaks of diseases are in many respects inevitable, epidemics and pandemics are preventable.
You know, we have this phrase that people love to coordinate, but no one likes to be coordinated. People ought to start liking to be coordinated. Otherwise, there are going to be bad outcomes to many of these disaster responses.
I liked one of the phrases that were given here: coordination, leadership, but also fellowship.
If we are going to prevent emergence, prevent amplification, prevent spread, then it's clear that we need to build better alliances across animal health sectors, human health sectors, environment and conservation sectors.
We bring people from communication, we bring people from other fields of research like meteorology, insurance companies, anthropologists, because these ways think out of the box. And I think this is very innovative from what we see in WHO.
It's very important for us, if we want to reform, to know what kind of risk we are going to face in the future. But also we know that WHO alone cannot do it. So we will need to be in partnerships with others. And it's good to start the partnership now as a stage of planning so that next crisis will be all together as well to respond.
This is the hope I have, that through this experience, through this exchange, we're going to have better option and approach to reinforce the local capacity for like a global benefit.
On a beaucoup à faire. Je pense que nous avons beaucoup d'atouts dans la main. Il faut maintenant jouer la partie. Pour cela, c'est vraiment penser que nous travaillons pour les autres, nous travaillons pour ceux qui réellement en ont besoin, et que de ce fait-là, nos divergences, nos difficultés organisationnelles doivent passer derrière de façon à ce qu'effectivement nous puissions vraiment travailler ensemble.